Welcome. I am Terry Tropin, and today I am presenting a lesson on ICD-10-CM coding for hypertension. Let me start with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have an RHIA and CCSP certification. In addition, I am an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I also have written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM coding, ICD-10 PCS, and external cause coding. These are available on Amazon. Here's some questions that will give you the information you need to select the correct code for hypertension in a specific case. First, does the patient have other conditions related to the hypertension? Then which came first, the hypertension or the related condition? What type of hypertension is documented? Are additional codes required? And is the hypertension associated with other conditions? Note that there are no separate codes to indicate controlled or uncontrolled hypertension. If you're old enough to remember ICD-9-CM, you'll know that there were different codes for that. That is not true in ICD-10. Use the appropriate code from I-10 to I-15 categories for controlled or uncontrolled hypertension. So, much like the question, which came first, the chicken or the egg, in most cases you need to determine whether the hypertension or the condition related to the hypertension came first. If there's no related condition, you use I-10, essential hypertension. If the hypertension came first, causing another condition, you use a code from categories I-11 to I-13 or O10 to O12 for pregnant patients. If the related condition came first, which caused the hypertension, you have I-15, which is secondary hypertension, O13, which the patient was pregnant and then became hypertensive, or I-97 for postoperative or post-procedural hypertension. In some other cases for hypertension, it will vary which came first. Examples of these are I-16, hypertensive crisis, and I-27, pulmonary hypertension. And we'll talk about each one of these in detail. Now, what kind of hypertension does the patient have? There are many different categories to choose from. Category I-10, which is primary or essential hypertension. Category I-11, which is hypertensive heart disease. Category I-12, hypertensive chronic kidney disease. Category 13, hypertensive heart and kidney disease. Category 15, which is secondary hypertension. Category I-16, which is hypertensive crisis. Category I-27, which is pulmonary hypertension. And then you have code I-97.3, which is postoperative or post-procedural hypertension. Finally, there's a code for transient hypertension, RO3.0. Each of these will be discussed in the next slide. Let's start with the most straightforward, easy one, I-10, essential hypertension. Note that this code has only 3 digits. So I-10 is arterial hypertension, systemic hypertension, primary hypertension. Either the patient has another condition, but it is not related to the hypertension, or does not have any other condition. So this is no other condition is related to the hypertension. Category I-11 is used for hypertensive heart disease. Remember that hypertensive means due to hypertension. The patient had hypertension first, and this led to heart disease. The alphabetic index will use words such as with, associated with, due to indicate that there is a relationship between the hypertension and the heart disease. Or the provider may just say these are related. You're going to use an additional code to identify the type of heart failure if it is documented. Not all cases of hypertensive heart disease will include heart failure, but if it does, you're going to code that separately. Now, I want to point out at the bottom of the slide is a notation, and this is where you will find this guideline in the official ICD-10 Coding Guidelines. So on the other hand, if the hypertension and the heart disease are not related due to different causes, the guidelines state the two conditions are coded separately. Code for the heart condition and code for the hypertension using I-10. Sequencing will depend on the circumstances of the admission. What's the main reason the patient is there? So category I-12 is used for patients with hypertension and chronic kidney disease. I-11 was heart disease, I-12 is kidney disease. Again, the alphabetic index will use words such as with, associated with, due to indicate that there is a relationship, a cause and effect between the hypertension and the heart disease. The patient had hypertension first, and because of that, developed the chronic kidney disease. The provider may just simply document that they are related. In that case, you use a code from category I-12. So additional categories, additional digits in category I-12 indicate a range of stages. It's not a specific stage, but it's a range of stages. Fourth digit 0 means it's a chronic kidney disease. Stage 5 or end-stage renal disease. Final digit 9 is stage 1 through 4 or unspecified. If a patient has hypertensive chronic disease, list first a code from I-12, then list a code for the chronic kidney disease from category N18. Remember that the fourth digit in I-12 was a range of stages. So you're going to also need a code from N18 to be more specific as to what is the stage. If documented, you're also going to list a code for acute renal failure from category N17. They may not all have acute renal failure, but if they do, you're going to use another code from N17. So let's do a practice. After I read the practice question, turn off the video and try coding it yourself. Then turn the video back on to check your answers. Okay, this patient has systemic hypertension and polycystic kidney disease, a congenital condition. So turn the video off and code it yourself. So the answers are I-10 and Q61.3. Since the hypertension and the kidney disease are not related because the polycystic kidney disease is congenital, I'll use a code from the I-10 category and a code for the congenital condition, not a code for hypertension with kidney disease, which would be I-12. So how do you find this? In the alphabetic index, find hypertension, which refers you to I-10. Systemic is an inclusion term used with the main term hypertension, one of those terms in parentheses. In the alphabetic index, then find polycystic kidney, which refers you to Q61.3. Let's go on to category I-13. This category is used for patients with hypertension, which cause both heart and chronic kidney disease. So they have hypertension, heart disease, kidney disease. It's all in category I-13. So the hypertension came first, and again, this is verified by use of code words such as with, associated with, due to, or through provider documentation. List first a code from category 13. Use additional code for the chronic kidney disease from category N18. And then if documented, if it's in there, code for heart failure or code for acute renal failure. So this will not always be the case, but if it is, you need to list codes for that if it's documented. Secondary hypertension. So for the codes categories we've discussed so far, the hypertension was present first, and because the patient was hypertensive, they caused another disease, heart, kidney, or both. For secondary hypertension, the other condition was present first and caused the hypertension. So what causes secondary hypertension? Well, this slide shows some examples. Renal conditions, endocrine conditions, neurogenic conditions, aortic coarctation, pregnancy, or stress. So they have one of these conditions, and because of that, they develop hypertension. So you want to list codes for both. You're trying to tell a story with the code. So you need to say the patient has secondary hypertension. Well, why? And then you have the condition that caused the hypertension. So list a code for the underlying etiology, the renovascular disease, whatever is causing it, and then a code from I-15 to identify that it's causing hypertension. In this case, sequencing will depend on why the patient is being seen at this particular time. So let's do another practice. Turn off the recording and try coding on your own, then restart the video to hear the answers. So the practice is secondary hypertension due to periarteritis nodosa. Patient seen for the hypertension this visit. So the answers are I-15.8 and M30.0. The patient is seen for the hypertension, so that code is listed first. So the alphabetic index, find hypertension secondary. There's no indent for circulatory conditions such as the arteritis, so we're going to use the other specified. It's specified, but there's no indent for it. There's no specific code for it. In the tabular list, a note under category I-15 says code also underlying condition. This means two codes are needed, but the sequencing depends on the circumstances. Remember the definition of code also. In this case, since the patient was seen for the hypertension, you're going to list that first. Then find periarteritis nodosa, which refers you to the M30.0. Hypertensive crisis is a severe increase in blood pressure that can lead to a stroke. This is reported using code from I-16. So you have I-16.0, hypertensive urgency, which means hypertensive crisis but no acute end organ damage at this time. I-16.1, hypertensive emergency, that is with end organ damage such as renal failure. So they're both really serious, but this is really, really serious. And then you have I-16.9, hypertensive crisis unspecified. Code also the hypertensive disease I-10, I-15 if applicable. It's a code also, so that means that the sequencing will depend. Pulmonary hypertension, category I-27, is high blood pressure in the lungs. See the diagram for the difference. See how the blood vessels here are constricted while the blood vessels here are wider. They're constricted, it's harder to pump, there's more pressure. Okay. Also called pulmonary arterial hypertension. It's a chronic disease that could end that can lead to right heart failure if untreated. And this can be primary or secondary. We have I-27.0, primary pulmonary hypertension, I-27.1, scoliotic heart disease, or I-27.2, other secondary pulmonary hypertension. Code also any associated underlying conditions, adverse effects of drugs or toxins. The sequencing is based on the reason for the encounter or guidelines for adverse effects. Remember that there's specific guidelines for adverse effects coding sequencing. Kyphoscoliotic heart disease is I-27.1. You can see here, see the spinal curvature. Spine curves to the right and forward or back, which puts pressure on the lungs, which can end up in pulmonary hypertension. Now, I-97.3 is used for postoperative or post-procedural hypertension. The hypertension must be clearly documented as due to the procedure. A patient may have high blood pressure before the surgery, and then of course they have it after the surgery. That's not a complication of the procedure. If the patient is admitted for the hypertension, list first post-op hypertension, the I-97 code, and then a code for the specific type of hypertension. Be sure again that it's clearly documented as due to the procedure. Transient hypertension is defined as over 150 systolic and 99 diastolic, and then there's later it's less. So this is a spike in blood pressure, but the provider is not ready to state the patient has hypertension. You want to record, the physician wants to record that the patient has high blood pressure at this time, but is not ready to state that it's confirmed hypertension. It will be, this is a way to make sure that it is monitored, okay? So the code for this is R03.3, and you find this in the index under elevated blood pressure. We discussed a lot of different codes that say use additional codes, particularly under the heart disease and kidney disease codes. But under all of the headings, under the heading for hypertension, which reaches I-10 to I-16, there's another important use additional code note. These are all risk factors for hypertension. So exposure to environmental tobacco smoke, which is Z77.22, history of tobacco dependence, Z87.891, occupational exposure to environmental tobacco smoke, Z57.31, and tobacco dependence, Z17, tobacco use, Z72.0. So all of these are important to also code to kind of track what's going on with the patient. Here's another practice. Again, turn off the video to try coding on your own. Patient is diagnosed with hypertensive chronic kidney disease stage 5. The patient is also dependent on dialysis, but not receiving dialysis during this encounter. So the codes are I-12.0, hypertensive kidney, which refers you to I-12.0. And there's a note under this code that reminds you to use additional code for the chronic kidney disease. So you're going to do N18.6. In the index, if you find disease kidney stage 5, this refers you to N18.5. But a note under this code says, refers you to N18.6 if this is end-stage renal, which this is because the patient is using dialysis. You're also going to use a code Z99.2 for dialysis. So here's another example of other codes. So it's so important to read those notes and to think about telling the whole story. Now, there are other conditions that hypertension may be associated with. The guidelines have specific rules for a couple of conditions, such as hypertensive retinopathy, hypertensive cerebrovascular disease, and hypertension in pregnancy. So let's start with hypertensive retinopathy. This occurs when the hypertension causes problems in the retina of the eye. So you're going to use two codes, one from H35.0, background retinopathy and retinal vascular changes, and then hypertensive disease from I-10 to I-15. The sequencing depends on the reason for the admission. Hypertensive cerebral vascular disease. Hypertension is a risk factor for stroke. The blood vessels in the brain may be narrowed, which increases the pressure in these vessels. The guidelines state the cerebral vascular code is listed first, and that would be I-60 to I-69, and then you're going to do a code for the hypertension. Hypertension in pregnancy. The coding depends, in this case, on whether or not the patient had hypertension before she became pregnant or whether she developed it after she became pregnant. So if she had hypertension and then became pregnant, list first a code from O10 to O12 and then a code for the hypertension. If she did not have hypertension, got pregnant, and then developed gestational hypertension, you're going to list a code from category O13. So it's very important to mark up your book. Make notes in your book. Make this stuff easy to find. There is no way you can remember all the guidelines, and you also want to be able to find these quickly by underlining some of the subterms, so it'll take your eye to that space without going through the whole list. The alphabetic index for hypertension is almost a whole page. So underline these subterms under hypertension: cardiorenal disease, gestational, heart, kidney, pulmonary, and secondary. And that's the way you'll find them very quickly. You might also go through and circle the code also and use additional code notes just to make sure you remember. So that completes this lesson. If you have questions or comments, please feel free to contact me. I would love to hear from you. You can contact me through Facebook, Tropin's Medical Coding Made Easy, or through email at Montgomery College. If you're interested in my books, these are all on Amazon. You can use this link or go to the Amazon books and type in my last name, Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. If there's something specific that you'd like me to talk about, contact me through Facebook. Thank you.